Hello everyone. I am going to try to record the video doing with using my computer. Having issues with my cell phone uploading the videos on YouTube, so I'm trying this alternate route. So with this week, I am going back to my symptoms that I had prior. I am going to go back to the PCOS as my diagnosis. With the PCOS, I am seeing more of the symptoms that are provided. They are correlating with PCOS more than they are correlating with the shingles, which is what I tried to diagnose it the previous week. With this week, I do see that one of the symptoms that we have is fibromyalgia. Sorry, you guys, I'm horrible at saying these words. But women with PCOS do have the fibromyalgia. They have the fatigueness, and they have the and it's also associated with the increased level of oxidative stress, which is what I stated in my previous discussion video. With having the oxidative stress levels, it does cause infertility, which is correlated to each other, which is a symptom of having PCOS. It also does cause insomnia for people with PCOS as well. What I also noticed is the muscle atrophy does correlate, is a symptom of having PCOS as well. The muscle atrophy, from what I looked at online, it is correlated with each other because when you lose the mass of the muscle, that is when the metabolism lowers, and that is which is the reason why PCOS patients have so many issues with losing weight, is because their metabolism is lower because they have already lost so much muscle. They have to lose mostly fat. I do believe that it is a more of a metabolic and more of a psychological disorder, because with your metabolism, as long as they can get their metabolism to a rate where they can start back losing weight, most women see a decrease in their issues and start having more regular periods and having less cysts on their ovaries. I also think it's psychological because it associates with anxiety and depression, because women feel as if they're infertile. It caused them to go into the depression, and also because they have features of a male, which of the facial hair growth and the discoloration of the body, it kind of puts them in a feeling of not as beautiful as they were before they were diagnosed with this. I do believe that it is affecting multiple organs in the body, because it does affect the uterus, because the uterus is not shedding its lining, because the PCOS patient is not having a period anymore, or they have more of an irregular period. I've seen cases where women have gone years without periods, and I've also seen cases where women go months without periods. And also because of the extra hair growth, they have an extra testosterone levels in their body, so they have more hair growth, and the hair is thicker and more dark as well. And also plus of the discoloration of the skin, the discoloration of the neck and under the arms and the stomach as well. Other tests that I would go by doing is a testosterone level. I would check to see if the patient has higher testosterone. I would also check their cortisol level, because then if I check the cortisol level, it can help me differentiate if they have PCOS or if they have Cushing's, and then I can kind of go from there. I would also check their insulin levels and see if they were pre-diabetic, or see how resistant is their insulin as well. The information that I gathered from is conqueryourpcosnaturally.com. I have the pcos.com, and then the nursing.columbia.edu. Thank you.